Welcome to Inspire and Ignite Learning with Safe States Alliance. Each month, we bring you a two-part series on a topic. This month is all about National Violent Death Reporting System data and how to leverage resources to maximize impact. You are watching part one of this series. Once you finish the recording, use the QR code to fill out our survey and tell us what you thought and what questions are still on your mind. It will only take 5 minutes. And after that, register for part two, our Ignite conversation on July 30th, an informal peer-to-peer discussion about using NC-VDRS data in your work. Hope to see you there.
Hi, I'm Scott Preschel-Bell. I'm the injury epidemiologist and unit manager in the North Carolina Department of Health and Human Services. Excited to be with you here today and share with you some of the information around VDRS and some of the things that we've done to try to make the data more accessible and more available. Let me share screen real quick and get things going. So again, I just want to make sure there's no conflict of interest to report. We receive funding from CDC through several cooperative agreements, including one specifically to VDRS. Obviously, continued federal funding is uncertain, and the North Carolina Department of Health and Human Services relies on this funding to keep people in North Carolina safe and injury-free. I also want to thank my team, the Injury Epidemiology Surveillance and Informatics Unit. We've been really working hard to kind of make data available and disseminate it and work with people to kind of put data to action. So a quick outline for today. What I wanted to do is share kind of a brief background to the VDRS, talk a little bit about our advisory board and some of the things we've done to make kind of data more accessible. Some of the promotion work we've done, share some key partnerships, some emerging partnerships, and some of the challenges ahead. So again, quick background. The North Carolina Violent Death Reporting System was one of the first 7 in the nation, 8 in the nation. We have nearly 35,000 cases have been entered to date. We have multiple partnerships across the state and across the nation. This is mostly done with CDC, a cooperative agreement that really funds us specifically to do the data collection. And so again, we're going to talk about ways in which we've tried to amplify some of that work and make sure that the data is also put into a little bit more action. And that funding has been limited for many years. I mean, it barely pays for the data collection piece. We actually chip in part from multiple sources to kind of make our work happen in the state of North Carolina. So again, I think having an active advisory board has been helpful. I want to share a little bit about the North Carolina Advisory Board. Fortunately, we're located around several universities, Duke, UNC, and then RTI, which is a research center, contracting agency. We have lots of local community partners, including local health departments, work in coordination with law enforcement. The Durham Police have been on board, the chief since the beginning. We have the Orange County Chapel Hill Sheriff who's on board. We have some of the data providers, including our Vital Records Unit and our Office of Chief Medical Examiner, and then several state organizations, the North Carolina Coalition Against Domestic Violence, North Carolinians Against Gun Violence, and North Carolina Office of Violence Prevention, which I'll share a little bit more later. Again, our advisory board meets generally about 2 times a year. Most of those are in person. Obviously during COVID, we did several that were online. We've recently did another online version just because some of the things we were trying to do didn't pull together. We've met at the Durham Police Department. We've met at RTI. We've met at UNC. We try to, move the advisory board meeting around a little bit to kind of share with various things. We hand out awards. Advisory board and several of them have been on since the very beginning, which is now 20 plus years. So we do have expectations around the advisory board. Again, we hope that they can be a springboard for some of the things, but really the 2 things I want to kind of outline today are facilitate data access and data dissemination. Also partnering like directly with us on some of our projects. So I'm going to talk a little bit about each of those. So again, we're trying to make the data more accessible. We've done a series of both data workshops and data presentations. I'm going to share a few examples with you today. The data user workshop was something that was started maybe about a decade ago, mostly with the UNC Injury Prevention Research Center, again, another key partner that I'll talk about a little bit later. But we were really wanting to make sure that people who we were working with understood the data, and it felt like, we had made a lot of strides in making the data, posting the data, working through some data governance issues, but people still weren't really using it. We think that the researchers in our state and others would be kind of a primary audience for some of that data. So we started working at Chapel Hill, where we would host basic meetings. Here you can see some pictures of one that took place at one point, where we would give presentations. The whole data workshop itself was probably about 2 hours. Sometimes we offered like a very simple lunch of pizza or salad or something that would bring some people together. And then that idea kind of expanded. And again, we ended up working with multiple universities, including UNC Pembroke, which again, there's some pictures here, where we actually worked with the faculty at UNC Pembroke, including the Chancellor, Robin Cummings, who was stopped by and kind of asked about some of the work that we were doing. And so we did that for several years. And every year we tried to kind of reach out to a handful of universities and others to make sure that they knew that we existed and knew about the work that we were doing. Again, in order to kind of make sure people were really understanding kind of the data that we had available, we created kind of a data toolkit. Again, these are some of the key bits of that toolkit. A list of recent projects. We posted our data request form. We would provide eventually a flat file, kind of a general use file, a code book, frequently asked questions. We even had a YouTube channel that we kind of dedicated a bunch of short presentations to. And then we also developed kind of a missingness guide. So again, that's all still available and posted on our website. And again, that was really specifically in partnership with the UNC Injury Prevention Research Center. Just wanted to mention kind of data governance. Anytime there's data sharing, particularly at a state level, we have a legal office that needs to be involved in that process, make sure what we're sharing is something that we can share. And so again, we work really closely with our data governance and our legal team to kind of really facilitate data sharing. It was several meetings. And they helped us develop some of the toolkit and some of the guidelines and our data request form, which we still use today. And then they help us manage some of the data, the DUAs, the data authorization, data users requests. So that's something that we work closely with our legal office and legal team with. So now I want to talk a little bit more about like promoting our data and making sure again that people know about it. I do think that obviously, if you build it, they will come is not necessarily true in a lot of these cases, and we really need to make sure that we're not just doing the data collection, that we're actually doing some of the use as well. I know, clearly if you're part of the national system, it's used at the national level, but again, making it available for the state and making it available to researchers and others, I think is really important. We've done several kind of road shows and VDRS tours. Again, if we're invited kind of anywhere at any time, we're pretty willing to try to make a presentation. We try to work it into a wide range of presentations. I frequently am asked to do meet and greets with university students at the School of Public Health, and we'll kind of work it in that way and get people excited about some of the data. And again, so I think that not only do we do things locally, but we do them at the state level and at the national level. So here's some of the things we do, even with the community. Durham has had a religious coalition for a nonviolent Durham. They meet in a church basement. These are people who are directly affected by violence in their community. They've been meeting for many years, and this is a presentation that I was giving at one point, where again, folks from Durham County and Durham, the city of Durham, were meeting and talking about this. That coalition also held vigils in Durham, where when people are killed, there's a vigil that's held. And again, we're an active participant in some of these events. Early on, there was a medical legal conference that our office of the North Carolina Office of Chief Medical Examiner would hold. Here you can see some old school presentations, the old science fair, print some PowerPoint slides and post them to the poster. Here you can see during that time, Dr. Butts, who was the chief medical examiner, and Dr. Radish, who became the medical examiner after Dr. Butts, and Dr. Freeman Bishop, who works in toxicology and is chief toxicologist in our state. Again, we got invited 1 year to the North Carolina Association of Chiefs of Police. At that point, then Attorney General Roy Cooper then became Governor Roy Cooper, who recently stepped down. We now have Josh Stein as our governor. But anyway, we were able to make a presentation. We worked with the Durham Chief of Police at the time, Chief Lopez, and talked with them and that group about kind of our work and what we do. We are also active kind of on the advocacy front. The North Carolina General Assembly hosts several different days that we can appear and talk with legislators and others about some of the work we do. You can see Dr. Tamara Coyne-Beasley, one of our advisory board members, a pediatrician at UNC at the time, now at the University of Alabama, and also Rod Jenkins, who is the health director at the Durham County Health Department, and I meeting with Monica Johnson-Hostler, who's a representative in the Wake County District, which is Raleigh. On the national front, again, Safe States Alliance Hill Day, Advocacy Day, is an opportunity for programs to share the work they do with legislators. Here you can see Rich and I, along with Beth Morocco and a staff person from Mark Walker's congressional office, meeting and discussing VDRS. And also some of the folks from this past year's team, including Sharon Gill Martin, Ciara Scott, Amy Patel, and others, Mitch Cunningham, meeting with the folks, and also Leah from IPRIC at UNC. So we met with multiple offices this year and most years, and it's a really great way to kind of shine some light on the work that you do. Again, it's really just talking about the work that you're doing and nothing really beyond that. There's other people who can do some of the requests and some of the asks and some of the things that sometimes state employees are less likely to be able to do. Again, just some pictures from Advocacy Day. Dr. Aurelius there in the bottom left corner is our current chief medical examiner. So I've taken a lot of advisory board members as part of a way for them to really help us champion VDRS and champion it up onto the congressional area. 1 year, this also included a brief visit to the White House and the Office of Violence Prevention under the Biden administration. Also, just want to spend a minute. I have very few data slides in this presentation. I think these are maybe the only two. And this would be a pretty typical slide that we would have as part of a slide deck. And in particularly even maybe 5 years ago, we would actually title it even different. The title would probably be Violent Deaths by Age Group Among North Carolina Residents, that kind of secondary line. But we've really moved to kind of embrace Stephanie Evergreen's kind of, hey, make sure you tell the story in your title. So again, this title has residents aged 20 to 24 years experience the highest rates of overall violent death in North Carolina. And we've tried to take it a step further, and I'm really trying to kind of help people understand the impact of some of the things that we do. So in this thing, it's basically that same graph, but now we've removed the firearm deaths. So if there were no firearm deaths and we were looking at the number of people, violent deaths overall in our state, there'd be nearly 8,000 deaths that would have been averted. So again, I'm trying to kind of tell parts of those stories and encourage you to tell some of those stories as well. We have a constant contact list, and we would love for you to join it. We send it out, 2 to 3 times a year, probably, sometimes up to 4. So anyway, it's basically a social marketing email where we send out program information about the most recent annual reports, about the fact sheets and things we've created. We also tend to highlight one of our advisory board members, and so again, this is a great way for them to kind of see and hear about kind of the work we've doing. I believe this goes out to somewhere in the neighborhood of like 500 different people across our state and across the nation, including maybe some of you as well. And again, for those of you who aren't registered, please register. We'd love to have you join. Again, I think the state programs that have VDRS programs, which is every state plus Puerto Rico and DC, need to play a real active role in promoting their programs and including some of the special data projects and other things that they're involved in. And again, I think it's really critical, particularly at this moment, to tell your stories and make the invisible visible. And we're a very important part of helping understand some of the violent deaths across our state and across the nation. And so please work hard to do that. Safe States also has a place where you can do advocacy as a private citizen or as in measured step in your role in the state or other jurisdictions. Also say that, data users need to continue to seek data and ask for partnerships as well. And sometimes it's demand that creates some of the supply, and sometimes it's the supply that creates the demand. And so really it's kind of this two-way street about making sure data is available, but also making sure that people are accessing it and utilizing it. Again, you don't want to be kind of you build it and expect people to come. You really have to work to kind of promote that. So I'm a big Bill Foege fan. Many of you might remember him. He was a former CDC director under the Carter administration and partly under the Reagan administration. A senior Gates advisor and basic public health hero. I love this quote: "The reason for collecting and analyzing, disseminating information on disease," and you can say injury as well, "is to control that disease. Data collection analysis should not be allowed to consume resources if action does not follow." So again, we're doing a great job collecting some of this information. We really need to do a better job of making sure that it's being used and taking action on. I'm going to talk briefly about some of our special projects that we have, data projects. And again, each one of these, like quite literally, can be a presentation of itself. And I've probably shared some of these presentations in the past. If you're interested in any of these presentations, we're happy to share them. But some of our work started with some of the elder maltreatment linkage that was done years ago with the VDRS program. We have pretty extensive work with kind of justice involved, formerly incarcerated populations around deaths following incarceration, on suicide, homicide, and overdose. We've done a series of things specific to suicide, given our comprehensive suicide prevention efforts and work. We have, again, advisory board members and others who are very interested in intimate partner and domestic violence. With the creation of the Office of Violence Prevention, we've really upped our game in terms of firearms surveillance and homicide specific and community violence. We've also had projects that involve Medicaid and other populations and linkages. Now, my team does a lot of this stuff, but we also have a lot of partnerships. Sometimes they're pretty simple in terms of like having a student who's at a school of public health or a place. And again, we are uniquely located nearby the University of North Carolina, Chapel Hill, which has a fantastic school of public health. But, a lot of these projects could easily be done remotely. And so again, proximity helps, but it isn't a necessary thing. We've had capstone projects who've evaluated the VDRS system. We've had medical residents from preventive medicine who've done various tasks and work related to VDRS. And we've also had master's and dissertation projects that have been done using VDRS data. Of course, some of the output is academic-ish publications. We've had a few of those as well. We're fortunate to really work with a lot of great people. We're usually not kind of the lead on some of these things, but we're certainly heavily involved. Again, we've been very fortunate to have kind of a wide range of people who we've worked with around a wide range of projects in our state. And again, this is just kind of a handful of some of the work that we've been doing. And I think that actually number has been growing. I'm not sure if I've updated it recently. So again, I want to talk about some special data partnerships. So more so than the data projects themselves, but the partnerships that allow us to kind of really do advanced kind of thinking and things related to some of this work. Again, a special shout out to the University of North Carolina, specifically the Injury Prevention Research Center. As many of you know, IPRIC is a CDC-funded Center of Excellence for Injury, also at risk in the current environment from losing potential funding down the road. But they really have three kind of main areas: research, outreach, and education that they're active in. During my time at the branch, they've had three different directors. Again, many of you probably recognize some of the names here. We've been very fortunate to have Carol Runyon, Steve Marshall, and Beth Morocco as the director of IPRIC. They have been fantastic partners. We think of it as a very kind of symbiotic kind of relationship and mutually beneficial, where we both kind of feel like we have advantages. They want to make sure all of their research and things are grounded in real world realities. We provide that real world reality for them at times. We also want to make sure that we're implementing and trying to do the things that are evidence-based and show the most promise as being successful. So again, we appreciate their willingness to kind of work with us. Again, there's a wide range of projects that have been done kind of completely pro bono. There have been other projects where we have had very small contracted situations where we provide some resources, but again, those have been, relatively limited in some ways. Want to also have a special shout out to the Council of State and Territorial Epidemiologists and their program for applied epidemiologists and informatics fellows. Again, the applied epi and data science training for early career professionals is one of the best things that have happened probably to our branch. In many ways, we get people who are working with us for 2 years, who are very passionate, who are very skilled, who are very willing to kind of put in some of the time necessary to really understand some of the work and things that we're doing. Like I said, it's an unbelievable deal. You get someone usually for around 2 years, depends on when they can kind of complete their competencies and when they can get another job and things of that nature. CSDE pays the salaries and benefits. The state provides the training and equipment. Again, it does involve a commitment of time, and I frequently say that the first year they're mostly learning, and then the second year they're mostly producing. So, you have to have staff and others who are willing to kind of commit to that kind of long-term training curriculum, and also have that environment where you have people who are in training situations. We only recently had an informatics fellow. We were very impressed with our informatics fellow and the work that they were doing. That's a different program, and usually they have funding for 1 to 2 years. Again, depends on some of the CST's funding streams. Same type thing. CDC pays the salary, state does the training and provides the equipment. It's a fantastic deal. Again, we've been really fortunate. We've been home to 13 CSTE fellows over time. Here are a handful of them. We now have hopefully an annual dinner that we do. And again, it's been really great to see kind of most of these young professionals kind of rise in their career. Almost all of them are still working in public health, so that's success number one. And many of them are working specifically in injury and violence, even though they didn't necessarily start off with injury and violence as an area that they were interested in. So 2 major successes of that program. I'd like to spend a little bit of time talking about some emerging partnerships that we're really trying to work through. Again, I know there's like a lot of acronyms on this slide, but I will walk you through them. The first one is the North Carolina Office of Violence Prevention. Second is the North Carolina Public Health Association. And the third is the North Carolina State Trauma Program. So together, this group has also been really active in terms of partnership with the Department of Health and Human Services at the state level. In March of 2023, Governor Cooper signed an executive order that created either the fourth or the fifth state office of violence prevention in the nation, and the first in the South. And multiple people and multiple entities were very involved. That office is actually based in the Department of Public Safety, but in close partnership with DHHS. So a little bit more on the Office of Violence Prevention, again, located in the Department of Public Safety. The Department of Public Safety's director is Ciara Scott, who we work with very closely. She worked at UNC IPRIC for a brief time and now oversees the work of that office. That office, again, has been expanding, creating kind of an advisory board of their own, creating fact sheet fact sheets that actually incorporate VDRS data. They have a strategic plan that's been out there, and so they've been really going to town in terms of stepping up and starting up a program and getting it kind of involved. Next is the North Carolina Public Health Association. Again, a chapter of the APHA, the American Public Health Association. The North Carolina Public Health Association is a big champion again of NC-VDRS. They host conferences, both educational and a leadership conference, where we frequently give presentations regarding VDRS and other projects. They also helped manage some of the logistics about some special events that we were involved in. They are a liaison to local health department, and some of the local health departments have put position statements in around firearms and violence, for example. And then again, they're our lead agency in our state around advocacy related work for public health. Again, a newer program that we're working with closely is the North Carolina State Trauma Program. We have 8 level 1 trauma centers in our state. Many of them now have hospital-based violence intervention programs, or HVIPs. And so again, places like Duke and Charlotte have offices on violence intervention, where people who are injured by firearm or other violence receive additional services kind of after they have been taken care of. Again, the trauma centers across our state are also in the midst of a big update of their plan, and we're trying to make sure that violence prevention is a big piece of that plan. And people like Dr. Eric Toshlag from Vidant ECU, East Carolina University, are major players in some of that work, which we really appreciate. I want to spend a little bit of time talking about a handful of special events that we've had. At one point, we were conducting kind of a VDRS speaker series. Again, this was in partnership with UNC IPRIC. They were bringing people to campus who were, national experts on violence prevention, people like David Hemingway, Daniel Webster, Phil Cook, who's also part of our advisory board. They would do kind of a big general audience presentation, and the VDRS advisory board would kind of meet with them before their presentation, kind of for a lunch and a question and answer period. And so again, that's been a really fantastic situation. Would love to kind of get it started again. It kind of has faded away, but maybe again we'll be able to bring it back at one point. The joke in the office is the next event was supposed to start as just a 1-hour lunch webinar, but it ended up being a very big conference that the state held, including presentations by Alex Crosby and Art Kellerman, and our state health officer, Betsy Tilson, and Secretary of Health and Human Services at the time, Cody Kinsley. So the Future of Violence Prevention in North Carolina became a partnership with the Public Health Association, our department, Department of Public Safety. It was held in Concord, North Carolina, which is just north of Charlotte, in September of 23. Again, our Secretary of Health and Human Services, Cody Kinsley, State Health Officer, Betsy Tilson, and the Secretary of Public Safety was also slated to be there. And at the time, the Office of Violence Prevention, Gerard Tate, was keynote speakers. We had 35 national and state speakers. We distributed some gun locks. We had a big celebration for VDRS, but also just a lot of conversations around violence in our state and what we can potentially be doing to make sure we're working through that. So again, just a handful of pictures from that event. Again, it was incredibly well received. It was a packed room. I felt like we could have actually had a 250. I felt like we also could have had 2 days. But we had a very tight 1-day conference with a lot of great speakers. Again, here's Art Kellerman, Alex, for those of you who know Dr. Crosby and others. And we actually did a Stop the Bleed training at the event. We handed out additional awards at the event. So it was a really good, fun day and a great way to kind of celebrate the 20-year anniversary of VDRS. That same year, we also had an opportunity with the North Carolina Medical Journal. Steve Marshall and I were asked to be guest editors for an issue that was supposedly a more general, broad injury and violence issue, which we had done in 2010, and we had asked for a follow-up to that. And then through conversations, we actually were able to narrow it down and have a dedicated special issue devoted to firearm violence and safety. Again, we have a great relationship with the North Carolina Medical Journal. They've been a great advocate for VDRS and have accepted several articles of work that we've done. Again, which is great because it goes out to all of the General Assembly lawmakers in the state, goes out to all of the medical professionals. I think when they had hard copy, it's now all online, but when they had hard copy, when the circulation was something like 30,000, and 80% of that was within the state of North Carolina. So it was going to a lot of different people, so much so that every now and then when certain items were popping up in the General Assembly, people would actually hold up the article from the North Carolina Medical Journal, specifically around potentially eliminating the motorcycle helmet law. And people were citing articles from the North Carolina Medical Journal to make part of that case. So again, it's wide circulation, lots of specific North Carolina examples, and we've had a great partnership with them. That issue came out in the summer of 2023. We had 15 articles, including sidebars from Governor Cooper, again, Secretary Kinsley and Secretary Buffalo, Department of Health and Department of Public Safety, and our state health officer, Betsy Tilson. Again, it's a great partnership with UNC IPRIC. Again, Steve Marshall at the time was the director there. And we had articles highlighting VDRS, FASTER, and some of the work of our branch and some of the work of my team. Again, here are the titles of those from that issue. We had a wide range of things that were happening in our state, and it felt at the time that there wasn't a lot of understanding that there were actions that were being taken, and we wanted to replicate some of those actions in the state. There were some really good things happening. I wanted to share some of those. I also want to mention that some of this, unfortunately, comes from an opportunistic situation, and I hate that I have to share a slide along these lines, but it is really important. Like sometimes what moves things are really tragic events. So in North Carolina in August of 2022, there was a mass shooting of 5 individuals in a neighborhood near Raleigh. The direct result of that was that the governor called and convened a series of roundtables that were led by Dr. Betsy Tilson at the time and others, both the Secretaries of Health and Human Services and Cody Kinsley and Secretary Buffalo from Department of Public Safety. The outcome of that was this white paper called Keeping Families and Communities Safe. Again, that paper, I think it was only 8 pages or so, but it had enlisted specifically VDRS data and other data as being primary data sources for some of this work. Again, Dr. Tilson has been a fantastic advocate. She just stepped down from her position at the beginning of this year. And again, she was the lead for the Department of Health and Human Services on a wide range of some of this work. And we really appreciate her championing it and being available to help us host conferences, help us connect with various people and organizations like ASTO and APHA and others. We'll spend a little bit of time on building relationships. Again, really important and key. We have a really important relationship with the city of Durham and the county of Durham. Again, they were at the table at the very beginning of VDRS, and in fact, Dr. Tamara Coyne-Beasley, among others, and Carol Runyon were really integral in terms of getting in some of that initial VDRS funding for the state. We also wanted to make sure, and Durham wanted to make sure that we stayed informed from a community perspective. So we created kind of this model of state and local partnership, and it really helped inform our program from the start, but also to this day. Rod Jenkins, in particular, current health director at the Durham Public Health Department, but also the past North Carolina Public Health Association president, Again, he's on our advisory board and a champion of violence prevention overall. He's been really fantastic. Helped us with the Concord event, the one-day conference that we had. Is actively involved in the Health Directors Association at the moment, so we're trying to take advantage of that too. Again, handful of people from Durham events, Missouri Holder, Marsha Owen, Jackie, Gail, lots of people from Durham have been very active kind of on this front, which we appreciate. Also wanted to mention our relationship with RTI International. RTI International is a 501c3. They're an independent research contractor based in Research Triangle Park in North Carolina. And they've been a major part of our work since the very beginning. Seen here is myself with Philip Graham, who runs a pretty large center at RTI. And we have had 3 advisory boards members from RTI, Kevin Strom, who sees a lot of their justice and criminal work. Philip, again, who sees both substance and justice involved population work, and Josie Cavas. Just want to talk briefly about some of the products we actually generate. Again, want to emphasize that our team has been amazing over the years. The glue, as you can see here, is Tammy Norwood. She's been the program manager from the beginning. She has been integral to all of the training and development and the work and the data quality of this team. She was recognized nationally by CDC a couple of years ago. And again, we're very fortunate to have Tammy among all of our advisory board folks, but also our abstractors who work day in and day out to work and generate the data that we use for these projects. We created a dashboard. Here's the QR code if you're interested in checking it out. Again, it's fairly simple. We use Tableau. We're updating it, so we'll have 2023 data available hopefully in the next month or so. And again, you can go to any county or have searches on specific topical areas, and we're trying to kind of expand it out when we have time and resources and capacity. And again, we've generated lots of different slide decks, quarterly reports, a lot of things that we share with different people, and we try to make them available to the extent we possible to partners and others that we send out, again, to various groups and various people. I want to briefly just mention some of the challenges that we're facing coming ahead. I'm sure many of you are familiar with kind of the braided funding notion of, hey, if you're receiving various funding streams, try to kind of weave some of them together. We have certainly tried to do that in our branch and with the work that we do. It's always interesting that the one group that funds always wants from the other program, while the other program always wants from the other. So we do our best in terms of really trying to be strategic about the funds that we have, and also about how we can kind of best leverage the resources, the limited resources that we have. And speaking about the resources, I mean, we're on a shoestring budget already, and really what it is an aglet. And again, if you don't know what that is, Google it. And I think that said, we're really facing some difficult times right now, and I think we're under increasing pressure to kind of demonstrate success, but I think that also has some complications as well. And I asked one of the AI platforms to help me generate a graphic of someone running with their knees cut off, and this is what they generated. But I feel like we're in this situation now where there have been some limitations. People have taken some pretty big cuts in some of the programs, but now we're asked to kind of demonstrate success, which makes it really challenging. And so I just want to recognize that and say that, just because, we've never had a lot of money, we've always done the best with it, but we have maybe even less now and are asked to even do more. So it's a really challenging time at the moment. So let me wrap some things up. Here are the basic take-home messages I wanted to leave with you. Most of the VDRS state programs are funded only for data collection, very specifically. So we've never really had any dedicated funding for promotion or dissemination. All of the stuff you've seen today has been kind of an indirect kind of work that we've been able to kind of work in when we can and partner when we can. I think the key to that has been really finding some champions. Again, we've had public health leaders who have been champions. We've had health directors who have been champions, researchers, community members groups. That advisory board really helps direct some of this, but not all of it. And again, we've been very fortunate in our state. We try to be as opportunistic as possible. And when someone is expressing an interest, we try to really meet their needs. Um, Another thing that's been useful is to kind of have a list of data projects and work that you want done and try to shop it around. Again, we're fortunate we're nearby several universities and places where there are a lot of students who are seeking work all the time. Some of that's complicated. I'm not denying the complications of sharing some of the data and some of the work or some of the ways that can happen. But there is this kind of disconnect between kind of student populations and universities needing to get experience and work that you need to get done in your office. And again, we've been able to, over time, try to figure out some of those things. And then again, take every advantage you have to present. You never know how partners emerge. I mean, we've presented to like 5 people in very small settings. Um, and we've also presented to huge rooms, and again, each one has opportunities and people who hopefully will be interested in the work that you're doing. And again, you never know who might partner or who might be interested and how things will play out, and then follow up. That's the key thing, is to be able to follow up. So I'm going to end here. I would encourage you to join our listserv. I mentioned it earlier. That's the constant contact. If you want to see the things that our state is up to related to some of this work, you can always email me. I'm available. And I've been trying my best to try to get a little bit more things out there on a platform with LinkedIn. So if you haven't seen some of my posts, I would encourage you to go check them out as well. And with that, I'd like to end today's presentation, and I appreciate your time, and best of luck. And I hope everything that I've shared here today, hopefully there's a few things that you'll find useful. Thank you.